Hello, I'm Ford Brewer, and this video is on the CDC guidelines for coronavirus testing. First, we'll talk about how to find the guidelines, navigate the web to get to the CDC website on the guidelines for coronavirus testing. Then we'll go into what the guidelines say. As we know, there's a lot of debate about whether the CDC should be offering it to more people and encouraging more testing. That's for a different video. That's for editorial, and we're not going to cover that. We're just going to cover what the CDC says today in this video. First of all, here's how to find it. Go to the CDC Coronavirus Testing Guidelines, or go to this link. If you can't get this link easily, just Google CDC Coronavirus Testing. Click on the first choice, the #1 place in the search engine results page. That will take you to this website. As you'll see, it's the Centers for Disease Control. It's on coronavirus disease 2019 or COVID-19. Along the left-hand side, you see some topics, some places to go. The large topic is testing in U.S. Now again, looking over on the left side, you see symptoms and testing. If you click on that, click on symptoms and testing, and you get to this web page. You see you've got 4 other buttons you can click: coronavirus self-checker, symptoms, reducing stigma, and testing. Now if you go to testing, which we'll do first, it gives you some basics about the testing, but then it takes you back to the coronavirus self-checker and symptoms. So we will walk through those again for the rest of this video. So the testing section, as I said, briefly reviews the symptoms and then refers you back to the symptom checker. Let's click on the testing area button, and here we go. They talk about testing for COVID-19. First of all, they recommend that you call your doctor. If you think you've been exposed to COVID-19 and develop a fever or symptoms such as cough or difficulty breathing, call your healthcare provider. And then the next button is the coronavirus self-checker, as I mentioned before. It also goes a little bit deeper into symptoms again. So again, even though you clicked on testing, it puts you back into more of a mode of looking for symptoms. So here's some of the symptoms again in a high-level summary that it gives you. If you're at higher risk for serious illness, and then it goes into what are the high-risk components for a serious illness. Obviously, it has to do with risk factors, and the next section talks about risk factors. Older adults, people with severe underlying chronic medical diseases like heart or lung disease or diabetes are at higher risk. Now, it goes on to say, look, if you're very sick, go get medical care. For example, if you have difficulty breathing, persistent chest pain, new confusion, if you're not arousable, bluish lips or face, this list is not all inclusive. In other words, if you're having emergency symptoms, go get emergency care. For healthcare professionals, there's another button you can click, and again, it takes you to other information which are specific to doctors and other healthcare professionals. So let's go back to the symptom checker, testing for COVID-19, and click on this blue button, this coronavirus self-checker. What happens at that point is that it pulls up an Azure-based automated chat. So here's the chat. The purpose of the coronavirus self-checkers help you make decisions about seeking appropriate medical care. It's not intended for the diagnosis or treatment of disease or other conditions, including COVID-19. This system is intended only for people who are currently located in the United States, and it was made possible through a partnership with CDC and Microsoft Azure platform. Then you click on I agree. The first question is, are you ill or caring for someone who is ill? I clicked no the first time through, and then the response is very simple and it kicks you back out. It says, look, sounds like you're feeling okay. The coronavirus self-checker system is for those who may be sick. Learn more about COVID-19 and what you can do on the CDC website. So then you can click on that and go there. But let's go back and say, are you ill or caring for someone who is ill? Click yes. Then they start getting into more questions. Where are you located, or where are they located, the person you're caring for that's ill? United States? Are you answering for yourself or someone else? I clicked someone else. Then the next question is, what is their age? I said 60 to 64. What is their gender? I said female. Then the next question is, what are they experiencing any of these life-threatening symptoms? Gasping for air, cannot talk without catching their breath, blue-colored lips or face, severe pain or pressure in the chest, severe or constant dizziness, and lightheadedness. So these may sound familiar. Those were some of the symptoms that we mentioned way back in the section on, quote, testing, which focused again symptoms and said, look, don't worry about testing if you have these symptoms. Go seek medical care. So after going through the list on those symptoms, I clicked none of the above. So the next question you get is, do they have any of the following? Moderate or severe cough or difficulty breathing? And I said none of the above. In the 2 weeks before they felt sick, did they have contact with someone diagnosed with COVID-19? Or did they live in a place where COVID-19 is spreading? I clicked no. So then the next question is, do they have any of the following? Fever or feverishness, chills and sweating, shortness of breath, cough, or other? I clicked on that they have cough. The next question that comes up then is, do they live in a long-term facility or nursing home? I said no. And in the last 2 weeks, have they worked or volunteered in a hospital, emergency room, clinic, medical office, long-term facility, nursing home, ambulance service, first responder services, or any healthcare setting, or taken care of patients as a student or part of their work? I clicked no, and then it's, do you or the person that you're calling for have any of the following conditions? Chronic lung disease, congestive heart failure, diabetes with complications, neurologic or brain conditions, cirrhosis of the liver, extreme obesity, etc. I clicked no, and they said at that point, okay, stay at home, take care of yourself, call your provider if you get worse. Sorry if you're feeling ill. If you have one or more of the symptoms that may be related to COVID-19, stay home, take care of yourself, and go back to our button on 10 ways to manage your health. So they're saying don't get testing at that point. Now, and let's go back up and look again briefly at the testing piece. You can go through this Azure automated chat and come back with several different options. One is, if you say you've got some of the critical symptoms like blue in the face, difficulty breathing, it bumps you back out to say, look, go get medical care. And that's good advice. So what they're looking for is this: people that have symptoms and maybe some connection. They've been working in a nursing home. They've been taking care of somebody with COVID-19 or one of those. If you go back up to the general recommendations for the CDC, here's what they've said from the very beginning. They want to recommend testing for people who are in the hospital with COVID-related signs and symptoms. They want to recommend COVID testing for people who've been taking care of COVID patients, healthcare workers, and others that are taking care of COVID workers. That's the second one. And then the third one is, if you have high risk for COVID, look to see if you have symptoms. If you don't have significant symptoms, don't go get tested. If you have emergency symptoms, still, don't get tested. Go and see an emergency healthcare provider. So that leaves a fairly narrow band of people that are at risk and have some minimal to moderate symptoms. I hope this helps. Again, I said I wasn't going to editorialize very much. Several groups have had some criticism and plea to start opening up testing to more people. We'll talk about that in other videos. Thank you very much for your interest. Continue to get great feedback regarding the webinars, and here's why. You know, on the internet, when you hear a webinar, you expect for somebody to try to sell you something. We're not doing that. We're trying to tell you something. People are coming in with their labs from Quest, inflammation panel, OGTT, insulin survey response, and then they're finding out Do I have inflammation? Do I have insulin resistance? And where does that fit in terms of other folks? We're getting ready to start one for CINT as well. So again, people are really excited about finding out their own status. Looking forward to seeing you there. Thanks.